Hi, I'm Michelle Merritt, President and CEO at New Futures. As a public health policy and advocacy organization, it is our responsibility to educate, raise awareness, and lead policy changes to improve health equity in our state. New Futures has developed a 5-point plan for a healthy state budget for the upcoming legislative session, and we're calling on lawmakers to support and prioritize public health programs and services, to grow New Hampshire's healthcare workforce, to grow and sustain behavioral health services and supports, to strengthen Granite State children and families, and ensure that every child in the state of New Hampshire has access to critical behavioral health supports. These 5 initiatives seek to address the COVID-19 pandemic, health disparities for historically marginalized groups, and to ensure the health and wellness of all Granite Staters now and into the future.
Existing health disparities have been exacerbated by the COVID-19 pandemic. To keep New Hampshire healthy and safe for years to come, there is a critical need to support public health initiatives. To continue to strengthen New Hampshire, we need to preserve and increase funds for local and state public health programs and services, and to create an essential, equitable, and no-cost adult immunization program. Doing so would aid our state in eliminating health disparities and protecting health and safety, and investing to protect all residents, and in providing a dynamic model to improve overall health and wellness in our state.
The COVID-19 pandemic has exposed and exacerbated New Hampshire's ongoing healthcare workforce shortage. Hospital capacity has been stretched thin, and service providers across the healthcare spectrum have struggled to attract and retain workers. Rural areas of the state, which faced the severe staffing shortages prior to the pandemic, have been hit especially hard. Addressing these workforce issues will allow people all over the state to access the right care at the right time and in the right place. To keep our state safe and healthy, it's critical that we support our healthcare providers in rural and underserved areas. We have to continue investment in the state loan repayment program for healthcare professionals, and we must maintain adequate Medicaid reimbursement rates to help providers care for those in need.
New Hampshire has some of the highest rates of substance misuse among youth and young adults in the country. The COVID-19 pandemic has exacerbated emotional challenges stemming from environmental stressors and created a detrimental disruption in prevention, treatment, and recovery services. To continue to strengthen New Hampshire, we need to continue to fully fund the Alcohol Fund and Medicaid expansion to ensure critical substance use disorder services, ensure solvency for substance use treatment and recovery programs, and invest in evidence-informed prevention. Substance use disorder is a preventable and treatable condition, and behavioral health challenges are a major cost to New Hampshire's economy. Prevention works and is effective, and with the needed investment, New Hampshire will continue to overcome the addiction and mental health crisis.
Our children are the future of New Hampshire. COVID-19 has devastated an already fragmented early childhood system, pushing providers and families to the brink. To best support our next generation, we must invest in family supports and strengthening services, which includes family resource centers, home visiting, and the state child care scholarship program. Access to early childhood opportunities that promote healthy brain development and reduce toxic stress during the early years are more effective and less costly. These critical investments help to prevent and mitigate childhood trauma, helping not only children but whole families, creating a healthier and more prosperous state overall.
New Hampshire's system of care law requires the state to develop and maintain integrated and comprehensive service delivery system for children with behavioral health needs, taking a systemic approach to improving child welfare and ensuring children and youth get appropriate support services. Supports like mobile crisis response are cost-effective and reduce the need for otherwise costly residential services. To continue to strengthen New Hampshire, we need to protect investment in mobile crisis and other community-based services. We need to maintain funding to support behavioral health services in schools and also ensure access to emergency and clinically appropriate residential care for children. Children do best with a coordinated system of supports to grow up safe and healthy. The cost savings from increasing access to these community-based services can be utilized in other important systems such as child protection and juvenile justice.